Welcome to the CMA Full Practice Test 2. This quiz contains 100 questions to help you prepare for the CMA full exam. Let's get started. Question 1. A patient in the intensive care unit suffers irreversible brain damage following a motor vehicle accident. The family wishes to donate the patient's organs. Which federal law requires hospitals to notify organ procurement organizations about potential donors? Option A. Patient Self-Determination Act, PSDA. Option B. Centers for Medicare and Medicaid Services, CMS, Conditions of Participation. Option C. HIPAA Privacy Rule. Option D. Uniform Anatomical Gift Act, UGA. The correct answer is B. CMS Conditions of Participation require hospitals receiving Medicare/Medicaid funding to notify designated organ procurement organizations, OPOs, of all patient deaths or imminent deaths. This federal requirement ensures that families are offered the opportunity to donate organs, supporting the national organ donation system. Question 2. A medical assistant is taking vital signs on a 4-year-old child at a pediatric clinic. The child is crying and restless. Which vital sign measurement should the medical assistant obtain first? Option A. Temperature. Option B. Respiratory rate. Option C. Blood pressure. Option D. Oxygen saturation. The correct answer is B. In a pediatric patient, the respiratory rate should be measured before any procedure that might cause further distress, because crying and agitation elevate the rate. Counting respirations while observing the child's chest before they become more upset provides the most accurate baseline reading. Question 3. A medical assistant is caring for a pediatric patient diagnosed with chickenpox, varicella. Which transmission-based precautions should be implemented, and what type of respiratory protection is required for healthcare workers? Option A. Airborne precautions with N95 respirator. Option B. Contact precautions with gown and gloves only. Option C. Droplet precautions with surgical mask. Option D. Standard precautions with no additional respiratory protection. The correct answer is A. Chickenpox, varicella, is transmitted via airborne droplet nuclei that remain suspended in the air and can travel long distances. Patients with chickenpox require airborne infection isolation in a negative pressure room, AIR. Healthcare workers must wear an N95 respirator or higher-level respiratory protection, not a standard surgical mask, because the virus particles are smaller than 5 microns and can remain airborne for extended periods. Question 4. ICD-10 CM codes for certain conditions include laterality designations to specify whether the condition affects the right side, left side, or bilateral sides of the body. Which character position in an ICD-10 CM code indicates laterality? Option A. The first character. Option B. The 5th or 6th character, depending on code structure. Option C. The 7th character. Option D. The 3rd character. The correct answer is B. Laterality in ICD-10 CM is indicated by characters in the 5th or 6th position, depending on the specific code category. Standard laterality codes include 1 equals right side, 2 equals left side, 3 equals bilateral, both sides, and sometimes 9 equals unspecified side when laterality is not documented. These designations are essential for accurate coding and must match the clinical documentation. Question 5. A female patient is scheduled for a pelvic examination. She appears uncomfortable and asks if someone else can be present during the exam. Which response by the medical assistant correctly addresses patient rights? Option A, you have the right to request a chaperone present during the examination for your comfort and protection. I can remain in the room, or you may request a family member or friend if you prefer. Option B, the examination must be private. Having another person in the room would interfere with the provider's work. Option C, only medical staff are allowed in the examination room for infection control reasons. Option D, your request will be denied because it's not standard practice at this clinic. The correct answer is A. Patients have the right to dignity, comfort, and protection during sensitive examinations. A chaperone, often the medical assistant or another staff member, may be present during pelvic, rectal, or other intimate examinations. The patient can request a chaperone, and the request should be accommodated. This protects both the patient's dignity and the provider from potential misunderstandings or allegations. Question 6. A patient develops a hematoma during venipuncture. Which immediate action should the medical assistant take? Option A, massage the area gently to help disperse the accumulated blood. Option B, apply warm compress to promote circulation and reduce bruising. Option C, remove the needle, apply pressure for 3 to 5 minutes, and select another site. Option D, continue drawing blood from a different site on the same arm. The correct answer is C. When a hematoma forms during venipuncture, blood leaks from the vein into surrounding tissue. The immediate action is to remove the needle, apply firm pressure for 3 to 5 minutes to stop bleeding, and then select a new site for the blood draw. Warm compresses may be applied later, after 24 hours, to help resolve the bruising. Question 7. A patient is being discharged with home oxygen therapy. Which safety instruction must be emphasized to prevent fire hazard? Option A, turn off oxygen flow when taking brief breaks from use. Option B, post no smoking signs in all rooms where oxygen is used and stored, and avoid open flames near oxygen equipment. Option C, store oxygen concentrators in the garage to protect them from household dust. Option D, keep oxygen tanks in a cool, dark closet away from sunlight. The correct answer is B. Oxygen supports combustion and dramatically increases fire risk. Patients receiving home oxygen therapy must be educated that smoking is strictly prohibited in any area where oxygen is used or stored. No smoking signs should be posted visibly. Patients must avoid open flames, candles, gas stoves, matches, lighters, within 10 feet of oxygen equipment. This is a critical safety instruction that can prevent life-threatening fires. Question 8. A patient is scheduled for an elective colonoscopy that requires pre-authorization from their insurance company. The medical assistant calls the insurance company to verify coverage and obtain authorization. Which information must be documented in the patient's record to demonstrate that proper authorization was obtained before the procedure? Option A, the authorization number, date obtained, authorized procedure, and authorized provider name. Option B, the patient's insurance premium payment history for the past 12 months. Option C, the insurance company's customer service representative's full name and home address. Option D, the complete list of all procedures the patient has ever had authorized by this insurance. The correct answer is A. Proper authorization documentation must include the authorization number, a unique identifier assigned by the payer, the date authorization was obtained, the specific procedure or service authorized, and the authorized provider name. This documentation demonstrates compliance with payer requirements and serves as evidence if a claim is later denied for lack of authorization. Question 9. A medical assistant is instructing a patient on proper technique for collecting a sputum specimen for tuberculosis, AFB smear. Which instruction is most important to ensure adequate specimen quality? Option A. Collect the specimen first thing in the morning before eating or drinking. Option B. Spit saliva from the mouth into the container after brushing teeth. Option C. Drink plenty of water before collection to thin secretions and improve yield. Option D. Cough gently and collect any oral secretions into the sterile container. The correct answer is A. For TB sputum collection, AFB smear, the optimal specimen is collected first thing in the morning before eating, drinking, or brushing teeth. Overnight accumulation of respiratory secretions in the lungs provides the highest concentration of organisms. The patient must produce a deep cough from the lungs, not saliva from the mouth. Morning collection ensures the best specimen for detecting tuberculosis organisms. Question 10. Which structured communication format is recommended for medical assistants when conveying clinical information to physicians and other healthcare team members? Option A. SOAP note format. Option B. Old Carts mnemonic. Option C. SBR format. Option D. PQRST mnemonic. The correct answer is C. SBR, Situation, Background, Assessment, Recommendation, is a standardized communication framework designed for interprofessional communication. It provides a clear, organized structure for conveying clinical information to healthcare team members, reducing miscommunication and improving patient safety. Question 11. Which HIPAA security rule safeguard requires the use of privacy screens on computer monitors in clinical areas where protected health information is displayed? Option A. Organizational safeguard. Option B. Physical safeguard. Option C. Administrative safeguard. Option D. Technical safeguard. The correct answer is B. Privacy screens on computer monitors are a physical safeguard under the HIPAA security rule. Physical safeguards are measures to protect electronic systems, equipment, and data from physical threats and unauthorized access. Privacy screens limit the viewing angle of monitors so that PHI cannot be seen by unauthorized individuals passing by or in adjacent areas. Question 12. A 68-year-old patient in the waiting room suddenly becomes unresponsive. A medical assistant confirms the patient is not breathing normally and finds no pulse. An AED is available. Which action should the assistant take after activating the emergency response system? Option A. Begin high-quality CPR and apply the AED pads as soon as available. Option B. Wait for the AED to analyze the rhythm before beginning chest compressions. Option C. Perform rescue breathing only until the AED arrives. Option D. Check for a pulse for a full 60 seconds before starting CPR. The correct answer is A. Current BLS guidelines emphasize immediate high-quality CPR beginning with chest compressions, 30 compressions followed by 2 breaths at a 30-to-2 ratio, while preparing to apply the AED. The AED should be applied as soon as it is available, with CPR continuing during pad application. Minimizing interruptions in compressions is critical for maintaining blood flow to the brain and heart. Question 13. A 62-year-old man presents for a routine follow-up. During allergy documentation, the patient states he is allergic to penicillin. Which follow-up question is most appropriate to complete the allergy record? Option A. Do you carry an epinephrine auto-injector for this allergy? Option B. Have you ever been tested for penicillin allergy at an allergy clinic? Option C. Would you like us to note this as a drug intolerance rather than a true allergy? Option D. What specific reaction did you experience when you took penicillin? The correct answer is D. Complete allergy documentation must include the specific reaction type, e.g., rash, hives, anaphylaxis, GI upset, and severity. This information helps distinguish true allergies from adverse effects or intolerances and guides prescribing decisions. A vague allergic to penicillin note without reaction details can lead to unnecessary avoidance of first-line antibiotics. Question 14. A medical assistant is performing a surgical scrub before assisting with a minor surgical procedure. Which technique is correct for the surgical hand scrub? Option A. Apply alcohol-based hand rub to hands and forearms for 30 seconds, then proceed to the sterile field. Option B. Scrub hands and forearms for 3 to 5 minutes with an antimicrobial surgical scrub agent, keeping hands above elbows. Option C. Wash hands briefly, then immediately don sterile gloves without drying hands. Option D. Scrub hands for 1 minute with plain soap and water, then apply alcohol-based hand rub. The correct answer is B. Surgical hand scrub requires thorough mechanical cleaning with an antimicrobial surgical scrub agent, such as chlorhexidine gluconate or povidone iodine, for a minimum of 3 to 5 minutes, covering hands and forearms up to the elbows. During scrubbing, hands must be held higher than elbows to allow water to flow from clean hands toward less clean elbows, preventing contamination. After scrubbing, hands are dried with sterile towels before donning sterile gloves. Question 15. Which of the following diseases is transmitted primarily through vector-borne transmission? Option A. Lyme disease. Option B. Tuberculosis. Option C. Influenza. Option D. Methicillin-resistant Staphylococcus aureus, MRSA. The correct answer is A. Vector-borne transmission involves pathogens transmitted by insects or arthropods, vectors, that carry the infectious agent from one host to another. Lyme disease is transmitted by the bite of infected ixodes ticks, deer ticks. The tick acts as the vector, transferring the bacterium Borrelia burgdorferi from infected animals to humans during blood feeding. Question 16. A patient refuses to have blood drawn for laboratory tests, stating, "I don't want to know my results. I'm afraid of what they might show." Which documentation best captures the patient's refusal? Option A. Patient refused blood draw due to fear of test results. Option B. Patient was non-compliant with physician orders. Option C. Blood draw canceled because patient was anxious. Option D. Patient declined blood draw. The correct answer is A. Documentation of patient refusal should include what was refused, the reason provided by the patient, and be written in objective, factual terms. This approach respects patient autonomy, provides legal documentation, and helps the care team address barriers to care. Including the patient's stated reason aids in future patient education and counseling. Question 17. A medical assistant processes an explanation of benefits, EOB, showing that a claim was denied with reason code CO 18, exact duplicate claim/service. The medical assistant checks the billing history and confirms the claim was submitted twice in error. Which action should the medical assistant take? Option A. Appeal the denial with documentation proving medical necessity. Option B. Immediately resubmit the claim with a different procedure code. Option C. Note the duplicate submission error and take no further action on the duplicate claim. Option D. Contact the patient to request payment for the denied service. The correct answer is C. When a claim is denied as an exact duplicate, it means the same claim was already submitted and processed. The denial is correct, and no further action should be taken on the duplicate. The medical assistant should document the error, ensure the original claim was processed correctly, and implement workflow changes to prevent duplicate submissions in the future. Question 18. A patient with terminal illness expresses interest in organ donation after death but has no documentation of this wish. The patient's family is opposed to donation when asked after the patient's death. Which analysis best explains the ethical resolution? Option A. The medical facility decides whether donation occurs based on institutional policy and organ availability. Option B. Organ donation cannot proceed without both patient documentation and family consent being present. Option C. The family's opposition overrides the patient's verbal wish because no written documentation exists. Option D. The patient's stated preference during life should be honored over family objections, reflecting respect for autonomy. The correct answer is D. Autonomy extends beyond death through advance expressions of donation preference. First-person consent, when the patient explicitly expressed donation intent, should legally and ethically override family objection in most states. Documenting the patient's verbal statements, who heard them, when context, helps hospitals honor the patient's wishes even without a signed donor registry entry. Question 19. A medical assistant is conducting a post-discharge follow-up telephone call with a patient who is hospitalized for pneumonia. Which element is most critical to assess during this call? Option A. The patient's insurance coverage and ability to pay for follow-up appointments. Option B. The patient's satisfaction with the hospital stay and nursing care quality. Option C. Whether the patient has completed the full antibiotic course and is experiencing any warning symptoms. Option D. Whether the patient has returned to work and resumed normal daily activities. The correct answer is C. Post-discharge follow-up calls should prioritize clinical safety assessment, medication adherence, symptom resolution or worsening, and warning signs requiring immediate medical attention. For pneumonia, incomplete antibiotic courses risk relapse or resistance, and warning symptoms like fever recurrence, shortness of breath, or chest pain indicate potential complications requiring urgent evaluation. Question 20. A 16-year-old female patient arrives for an annual well visit examination. Her mother remains in the waiting room. During the clinical intake, which screening topics should the medical assistant address privately with the adolescent according to standard adolescent well visit protocols? Option A. Family medical history, medication allergies, and insurance coverage. Option B. Dietary preferences, sleep habits, and exercise routines. Option C. Substance use, sexual health, mental health, and safety behaviors. Option D. Academic performance, extracurricular activities, and college plans. The correct answer is C. Adolescent well visit protocols include confidential screening for sensitive topics, substance use, tobacco, alcohol, drugs, sexual health, activity, protection, STI risk, mental health, depression, anxiety, suicidal ideation, and safety behaviors, risk-taking, violence exposure, driving safety. These screenings must be conducted privately to encourage honest responses and protect adolescent confidentiality within legal limits. Question 21. A patient is being discharged after a minor surgical procedure to remove a sebaceous cyst on the back. Which instruction should the medical assistant include in the post-procedure discharge education? Option A. Apply hydrogen peroxide directly to the wound twice daily to promote healing. Option B. Remove any sutures at home after 3 days using clean scissors from the home. Option C. Keep the wound covered with a tight bandage for the first 48 hours without checking it. Option D. Change the dressing daily or as directed, keeping the wound clean and dry between changes. The correct answer is D. Standard post-procedure wound care instructions include regular dressing changes, keeping the wound clean and dry, and monitoring for signs of infection. The medical assistant should provide specific guidance on dressing change frequency based on the provider's orders and wound characteristics. Question 22. A medical assistant is transferring a non-ambulatory patient from a wheelchair to an examination table. The patient weighs approximately 180 pounds and cannot assist with the transfer. Which approach best ensures patient and staff safety? Option A. Slide the patient across using a transfer board while the patient remains seated. Option B. Use a mechanical lift device with appropriate sling and have at least 2 staff members assist. Option C. Use a gait belt and attempt a 2-person lift to transfer the patient. Option D. Ask the patient to try standing while you provide support at the wheelchair. The correct answer is B. For a non-ambulatory patient who cannot assist with transfer and weighs 180 pounds, a mechanical lift is the safest option for both patient and staff. Manual lifting of non-ambulatory patients poses high risk for staff back injuries and patient falls. OSHA and Safe Patient Handling Guidelines recommend mechanical lifts for patients who cannot bear weight or assist. At least 2 trained staff members should be present for safe operation. Question 23. A medical assistant is preparing to administer a subcutaneous injection of insulin to a thin, frail elderly patient with minimal subcutaneous tissue. Which angle should be used for needle insertion? Option A, 60 degrees. Option B, 90 degrees. Option C, 45 degrees. Option D, 5 to 15 degrees. The correct answer is C. Subcutaneous injections should be administered at a 45-degree angle in thin patients with minimal subcutaneous tissue to ensure the medication enters the subcutaneous layer rather than intramuscular tissue. In patients with adequate subcutaneous tissue, a 90-degree angle may be appropriate. The angle selection depends on patient body habitus and needle length. Question 24. A medical assistant is preparing to draw blood from a patient with no known infectious disease. The patient appears healthy and has no visible skin lesions. Which infection control approach applies to this situation? Option A, contact precautions in addition to standard precautions. Option B, no precautions needed because the patient has no known infection. Option C, standard precautions only, treating all blood as potentially infectious. Option D, airborne precautions because blood draws may aerosolize pathogens. The correct answer is C. Standard precautions are the minimum infection control practices that apply to all patient care, regardless of known infection status. Under standard precautions, all blood, body fluids, secretions, and excretions are treated as potentially infectious. This approach protects healthcare workers from undiagnosed or asymptomatic infections. Gloves are required for blood draw procedures, and hand hygiene must be performed before and after. Question 25. The medical office has implemented a no-show policy that states, patients who miss 3 appointments without canceling will be sent a letter notifying them that future appointments must be scheduled in person. A patient has missed 2 appointments in the past 4 months and calls today to schedule another visit. The provider's schedule is full for the next 2 weeks. Which decision demonstrates appropriate application of office policy and scheduling judgment? Option A, deny the appointment request entirely due to the patient's history of missed appointments. Option B, schedule the patient for the first available slot in 2 weeks, provide appointment reminder instructions, and document the appointment history. Option C, schedule the appointment but warn the patient that they will be dismissed from the practice if they miss this one. Option D, require the patient to come in person immediately to schedule, bypassing the policy threshold. The correct answer is B. The patient has missed 2 appointments, which is below the 3-appointment threshold that triggers in-person scheduling requirements. The appropriate action is to schedule the patient for the first available slot, provide reminder instructions to reduce no-show risk, and document the appointment history. The policy applies only after 3 missed appointments, and the patient should not be penalized before reaching that threshold. Question 26. A medical assistant notices that a provider's documentation consistently shows higher-level E/M codes 99214, 99215 for routine follow-up visits that appear to involve minimal medical decision-making. Several claims have been flagged for review. Which billing practice does this pattern potentially represent, and what is the appropriate action? Option A, undercoding, the practice of billing lower-level codes than services provided. The provider should be commended. Option B, bundling, the practice of combining multiple services into one code. The billing should be corrected. Option C, upcoding, the practice of billing higher-level codes than documentation supports. This should be reported to the compliance officer. Option D, appropriate billing for complex patient populations. No action required. The correct answer is C. Upcoding is a fraudulent billing practice in which providers bill higher-level service codes than what the documentation supports. Billing 99214 or 99,215 for visits that involve straightforward or low-level medical decision-making, limited examination, and minimal history constitutes upcoding when the documentation does not justify the higher-level codes. This pattern should be reported to the compliance officer for internal review, auditing, and corrective action to prevent fraud liability. Question 27. A medical assistant discovers that a patient's HIV test results were inadvertently faxed to the patient's employer instead of the patient's requested primary care physician. The employer's fax number was entered incorrectly during the transmission process. Which sequence of actions should the medical assistant take to address this HIPAA breach involving special protected information? Option A, contact the employer and ask them to shred the fax documents without further reporting since the employer is a legitimate business. Option B, notify the provider immediately, document the breach incident, report to the privacy officer, and follow breach notification protocols for HIV-specific protected information. Option C, retrieve the fax documents from the employer and assume no breach occurred once the documents are recovered. Option D, report the incident to the patient only and allow the patient to decide whether further action is needed. The correct answer is B. HIV test results have special protections under many state laws and HIPAA provisions, requiring heightened protection. An inadvertent disclosure to an unauthorized party constitutes a potential breach. The medical assistant must immediately notify the provider, document the incident details, report to the privacy officer, and follow the facility's breach notification protocol. Many states require specific breach notification procedures for HIV information. Prompt reporting supports proper assessment, mitigation, and compliance with breach notification requirements. Question 28. Which federal regulation requires that prescriptions for Schedule II controlled substances cannot be refilled without a new written prescription from the provider? Option A, Clinical Laboratory Improvement Amendments, CLA. Option B, Health Insurance Portability and Accountability Act, HIPAA. Option C, Occupational Safety and Health Act, OSHA. Option D, Controlled Substances Act, CSA, and DEA regulations. The correct answer is D. The Controlled Substances Act enforced by the Drug Enforcement Administration, DEA, establishes strict regulations for Schedule II controlled substances. Schedule II drugs, such as oxycodone, hydrocodone, Adderall, and Ritalin, have high abuse potential but accepted medical use. Under DEA regulations, Schedule II prescriptions cannot be refilled. A new prescription must be issued by the provider for each dispensing. Electronic prescribing of controlled substances, EPCS, is permitted but requires additional security measures. Question 29. Which oxygen saturation, SpO2, value indicates a critical finding that requires immediate provider notification? Option A, 88%. Option B, 96%. Option C, 94%. Option D, 92%. The correct answer is A. Normal SpO2 for a healthy adult is 95 to 100%. And SpO2 below 90% is considered hypoxemia and requires immediate intervention. A reading of 88% indicates significant hypoxemia and is a critical value that must be reported immediately to the provider. Values of 90 to 94% warrant monitoring but are not immediately critical. Question 30. A patient presents with symptoms of depression including fatigue, decreased interest in activities, and difficulty concentrating. The patient tearfully states, "I just don't feel like myself anymore. I don't know if life is worth living." Which communication response demonstrates appropriate mental health first aid awareness? Option A. Document the statements and notify the provider immediately without further conversation. Option B. Encourage the patient to focus on positive aspects of life and things that bring joy. Option C. Ask directly whether the patient is thinking about suicide or has a plan to harm themselves. Option D. Reassure the patient that depression is common and will likely improve with treatment. The correct answer is C. When a patient expresses statements suggesting possible suicidal ideation, "I don't know if life is worth living," mental health first aid protocols recommend direct assessment of suicide risk. Asking directly about suicidal thoughts, plans, and means is not harmful and is necessary to determine the level of risk and appropriate intervention. Direct questioning opens the door for honest discussion and appropriate crisis response. Question 31. A medical assistant is preparing for medical record destruction after the required retention period has elapsed. Which method of destruction ensures HIPAA-compliant disposal of paper medical records containing protected health information? Option A. Shredding documents using cross-cut shredders that render documents unreadable and unreconstructible. Option B. Discarding documents in locked office trash bins for municipal waste pickup. Option C. Burning documents in an outdoor incinerator without witness verification. Option D. Recycling paper documents through standard municipal recycling services. The correct answer is A. HIPAA requires that protected health information, PHI, be destroyed in a manner that renders it unreadable and unreconstructible. Cross-cut shredding meets this standard by cutting paper into small particles that cannot be reassembled. Medical offices should maintain documentation of the destruction process, including date, method, and witness verification, to demonstrate compliance during audits. Question 32. A medical assistant is reviewing the denial management workflow for a medical practice. Which term describes the initial internal review process where the billing team identifies the denial reason, determines if it is a coding error or coverage issue, and decides whether to correct and resubmit or file an appeal? Option A. External review. Option B. First-level appeal. Option C. Denial triage. Option D. Claim adjudication. The correct answer is C. Denial triage is the initial internal review process where denied claims are categorized by denial reason, analyzed for root cause, coding error, missing information, coverage denial, timely filing, etc., and routed for appropriate action. Claims with correctable errors, such as missing modifier or incorrect code, are corrected and resubmitted, while coverage denials proceed to the appeals process. This workflow step is critical for efficient revenue cycle management. Question 33. A provider is closing an incision and requests an absorbable suture material. Which of the following suture materials should the medical assistant prepare? Option A, silk suture. Option B, nylon suture. Option C, polyglycolic acid, dexin/Vicryl suture. Option D, polypropylene, proline suture. The correct answer is C. Polyglycolic acid sutures, brand names Dexin, Vicryl, are absorbable synthetic sutures. They are made from synthetic polymers that gradually break down and are absorbed by the body over time, typically 7 to 14 days for tensile strength loss, complete absorption in 60 to 90 days. Absorbable sutures are used for internal tissues, deep layer closure, and situations where suture removal would be difficult or unnecessary. Question 34. A medical assistant is preparing to assist with a sterile surgical procedure in an outpatient surgery center. Which type of gloves should the assistant don after performing the surgical scrub? Option A, sterile surgical gloves that are packaged individually and opened using sterile technique. Option B, non-sterile clean disposable gloves for general patient contact. Option C, heavy-duty utility gloves used for instrument cleaning and decontamination. Option D, nitrile examination gloves from a bulk box dispenser. The correct answer is A. For sterile surgical procedures, the medical assistant must maintain surgical asepsis after completing the surgical scrub. Sterile surgical gloves are required because they provide a sterile barrier that prevents contamination of the sterile field and the surgical site. These gloves are individually packaged and must be opened and donned using sterile technique, the open gloving or closed gloving method, to avoid touching the outer sterile surface. Question 35. A medical assistant reviews a provider's documentation for a patient diagnosed with acute bronchitis. The provider also documents that the patient has essential hypertension and type 2 diabetes without complications, both currently managed with medications. Which coding principle guides the sequencing of diagnoses on the claim form when bronchitis is the reason for today's visit? Option A, the chronic conditions, hypertension, diabetes, should be listed first because they require ongoing management. Option B, the diagnosis for the chief complaint, bronchitis, should be listed first as the primary reason for the encounter. Option C, all diagnoses should be listed alphabetically by code for standardized claim processing. Option D, the diagnosis with the highest reimbursement potential should be listed first to maximize payment. The correct answer is B. ICD-10 CM coding guidelines require that the primary diagnosis, first listed diagnosis, represent the main reason for the patient's encounter, the condition, problem, or symptom that prompted the visit. For an outpatient visit, the chief complaint determines the sequencing. Acute bronchitis is the reason for today's visit, so it should be sequenced first. Chronic conditions managed during the visit are reported as secondary diagnoses. Question 36. A medical assistant is documenting a telehealth visit in the electronic health record. The patient participated in the video visit from their home. Which documentation elements are specifically required for telehealth encounters compared to traditional in-person visits? Option A, only the provider's name and diagnosis are required. Patient location and technology used are irrelevant. Option B. Telehealth visits do not require any documentation since they are not considered real medical encounters. Option C. Documentation requirements are exactly the same for telehealth and in-person visits, with no additional elements. Option D. Documentation must include the telehealth platform used, patient location at time of visit, and notation that the visit was conducted via telehealth technology. The correct answer is D. Telehealth documentation requires additional elements beyond standard visit documentation. These include noting the telehealth platform or technology used, video, phone, documenting the patient's physical location at the time of the visit, home, workplace, etc., and clearly indicating that the encounter was conducted via telehealth. These elements support billing compliance, legal documentation requirements, and care coordination. Question 37. A patient asks the medical assistant to explain the difference between an HMO and a PPO insurance plan. Which statement accurately describes a key difference between these two plan types? Option A. Both HMO and PPO plans require patients to select a primary care physician and obtain referrals before seeing specialists. Option B. Both HMO and PPO plans have identical cost-sharing structures with the same copays, deductibles, and coinsurance percentages. Option C. HMO plans typically have lower premiums and require PCP referrals, while PPO plans allow direct specialist access without referrals, but usually have higher premiums. Option D. PPO plans restrict coverage to in-network providers only, while HMO plans allow out-of-network access at higher cost. The correct answer is C. HMO, Health Maintenance Organization, plans are characterized by lower premiums, mandatory primary care physician, PCP, selection, and required referrals for specialist visits. PPO, Preferred Provider Organization, plans offer greater flexibility with no referral requirements for specialists, allowing patients to see any provider, but typically charge higher premiums for this flexibility. This fundamental trade-off between cost and flexibility distinguishes the two plan types. Question 38. A 17-year-old patient requests HIV testing and states she does not want her parents to know. She lives independently, works full-time, and pays her own medical bills. Which analysis best determines whether this patient can consent to testing without parental notification? Option A. The patient can consent only if she proves she has a medical emergency requiring immediate testing. Option B. The patient must bring a parent to sign consent, but results can remain confidential. Option C. The patient qualifies as an emancipated minor based on independent living and self-support and can consent to confidential HIV testing. Option D. The patient cannot consent because all minors under 18 require parental permission for any medical testing. The correct answer is C. Emancipated minors are legally recognized as having adult decision-making capacity when they live independently, are self-supporting, married, or in the military. This patient meets emancipation criteria: independent living, full-time work, self-paying bills. Emancipated minors can consent to medical care, including confidential testing for conditions like HIV, without parental involvement or notification. Question 39. A medical assistant is assisting with specimen collection for a wet mount preparation during a gynecologic examination. The patient reports vaginal discharge and itching. Which of the following is the primary purpose of a wet mount examination? Option A. To detect sexually transmitted infections including gonorrhea and chlamydia. Option B. To assess hormone levels and determine menopausal status. Option C. To identify vaginal infections such as bacterial vaginosis, trichomoniasis, and candidiasis. Option D. To screen for cervical cancer and human papillomavirus, HPV infection. The correct answer is C. Wet mount, wet prep, microscopy is used to diagnose common vaginal infections. A sample of vaginal discharge is mixed with saline and examined under a microscope. Bacterial vaginosis is identified by clue cells, epithelial cells with bacteria attached. Trichomoniasis shows motile flagellated organisms, and candidiasis, yeast infection, reveals budding yeast or pseudohyphae. The KH prep, potassium hydroxide, enhances yeast visualization. Wet mount is a rapid, point-of-care diagnostic tool for vaginitis. Question 40. A surgical wound is classified as clean contaminated when which of the following conditions applies? Option A. The wound resulted from trauma with gross contamination from foreign material or fecal matter. Option B. The wound involves necrotic tissue, existing infection, or perforated viscera at the time of surgery. Option C. The wound was created under ideal sterile conditions and did not enter any body cavity. Option D. The wound was created under sterile conditions but entered a hollow viscus, GI tract, respiratory tract, without unusual contamination. The correct answer is D. Clean contaminated wounds are surgical wounds created under sterile conditions where the procedure entered a hollow organ or body cavity, GI tract, respiratory tract, genitourinary tract, oropharynx, under controlled conditions without significant contamination. Examples include planned entry into the gastrointestinal tract without spillage, hysterectomy, tonsillectomy, and appendectomy without rupture. These wounds have a moderate infection risk, approximately 10 to 20%. Question 41. Place of service, POS, codes are two-digit codes used on medical claims to identify the location where a healthcare service was rendered. Which place of service code indicates that a service was performed in a physician's office? Option A, POS 81. Option B, POS 99. Option C, POS 22. Option D, POS 11. The correct answer is D. Place of service code 11 indicates a physician's office, defined as a location where a health professional provides routine patient care, examinations, diagnosis, treatment, on an outpatient basis. This is the most common POS code for primary care and specialty office visits. Accurate POS codes ensure proper claim processing and reimbursement rates. Question 42. Which of the following is required by the OSHA bloodborne pathogen standard for healthcare facilities? Option A, mandatory HIV testing for all employees annually. Option B, an exposure control plan that identifies job classifications with occupational exposure risk. Option C, use of cloth gloves for all patient contact procedures. Option D, elimination of all sharps from the clinical environment. The correct answer is B. The OSHA bloodborne pathogen standard, 29 CFR 1910.1030, requires healthcare facilities to develop and maintain an exposure control plan that identifies job classifications where employees have occupational exposure to blood or other potentially infectious materials, OPM. The plan must also outline engineering controls, work practice controls, PP requirements, hepatitis B vaccination availability, and post-exposure evaluation procedures. Question 43. A medical assistant is reviewing patient accounts and notices a credit balance of $45 on a patient's account. The credit resulted from an overpayment when the patient's insurance paid more than expected and the patient also paid a copay at the time of service. Which action represents proper credit balance resolution? Option A, adjust the credit balance to zero without patient notification or documentation. Option B. Transfer the credit balance to another patient's account who has an outstanding balance. Option C. Contact the patient to inform them of the credit balance and arrange either a refund check issuance or application of the credit to future services. Option D. Leave the credit balance on the account indefinitely since credits are favorable to the practice. The correct answer is C. Credit balances, overpayments, must be resolved promptly and properly. When a credit balance is identified, the patient should be notified and given options: receive a refund check for the overpayment amount, or apply the credit to their account for future services. This resolution must be documented in the patient's account. Leaving credits unresolved or transferring credits between patient accounts violates proper accounting practices and may constitute fraud. Many states have laws requiring timely refund of credit balances. Question 44. What is the correct sequence for measuring orthostatic, postural, hypotension in an adult patient? Option A. Measure blood pressure lying down for 3 minutes, have patient stand, and measure immediately and at 3 minutes standing. Option B. Measure blood pressure lying down, immediately after standing, and again after 5 minutes of standing. Option C. Measure blood pressure standing first, then after the patient lies down for 10 minutes. Option D. Measure blood pressure sitting, then standing, then lying down. The correct answer is A. Orthostatic hypotension measurement requires the patient to lie supine for at least 3 minutes, then stand, with BP measured immediately upon standing and again after standing for 3 minutes. A drop of 20 millimeters of mercury in systolic or 10 millimeters of mercury in diastolic pressure indicates orthostatic hypotension. Question 45. A medical assistant is applying a Holter monitor. Which instruction is most important to give the patient before they leave the office? Option A. Remain in bed as much as possible. Option B. Keep a detailed diary of activities and symptoms. Option C. Avoid taking showers for the entire monitoring period. Option D. Do not bend over or twist the torso. The correct answer is B. The Holter monitor diary is essential for correlating the patient's symptoms and activities with the continuous EKG recording. Without accurate diary entries, the physician may be unable to determine whether arrhythmias detected on the tracing are clinically significant or incidental. Question 46. A medical assistant is managing the front desk during a busy morning. 3 communication demands arrive simultaneously: a patient calling with chest pain symptoms, an elderly patient at the desk asking a billing question, and a lab courier waiting for specimens. Which action demonstrates correct prioritization of communication needs? Option A. Ask the lab courier to wait, finish with the elderly patient, then answer the phone. Option B. Transfer the phone call to a nurse immediately, then assist the elderly patient, then process specimens. Option C. Address the elderly patient's billing question first, since they are physically present. Option D. Tell the elderly patient to wait, process specimens quickly, then answer the phone. The correct answer is B. Clinical urgency is the primary prioritization factor. Chest pain is a potentially emergent symptom requiring immediate triage assessment. The phone call must be escalated first. The elderly patient at the desk has a non-urgent billing question, but is present and deserves attention after the urgent call is routed. The lab courier can wait briefly as specimen transport has time sensitivity, but is not a patient safety issue. Question 47. A 7-year-old patient presents with sore throat, fever, and swollen lymph nodes. The provider orders a rapid group A streptococcus test. Which specimen collection method should the medical assistant use? Option A. Swab the posterior pharynx and tonsillar areas using a sterile throat swab. Option B. Swab the tongue and buccal mucosa using a cotton-tipped applicator. Option C. Collect a sputum specimen by asking the patient to cough deeply. Option D. Swab the nasal passages using a nasopharyngeal swab. The correct answer is A. A rapid group A streptococcus test requires a throat swab specimen collected from the posterior pharynx and tonsillar areas where streptococcal bacteria typically colonize. The medical assistant should use a sterile throat swab, have the patient open their mouth and say, "ah," and firmly swab both tonsillar areas and the posterior pharynx while avoiding contact with the tongue, cheeks, or uvula. Question 48. A provider orders a home health referral for a 78-year-old patient discharged after hip replacement surgery. The patient lives alone, has difficulty with activities of daily living, ADLs, and requires wound care and physical therapy. Which documentation is most critical for the medical assistant to include in the referral? Option A. The patient's insurance policy number and group number only. Option B. A brief note stating patient needs home health after surgery. Option C. Current medication list, wound care orders, physical therapy orders, patient's functional status, and caregiver support availability. Option D. The patient's preferred home health agency based on advertising the patient has seen. The correct answer is C. A comprehensive home health referral requires detailed clinical information to ensure appropriate care planning. This includes current medications for reconciliation, specific wound care orders, frequency, supplies, technique, physical therapy orders, frequency, goals, functional status, mobility level, ADL assistance needed, and available caregiver support. This information allows the home health agency to assign appropriate staff, bring necessary supplies, and develop a care plan. Incomplete referrals delay care initiation. Question 49. A medical assistant is administering an Ishihara color vision test to a patient applying for a commercial driver's license. Which administration technique ensures accurate test results? Option A. Project the plates on a wall 3 meters away and allow the patient 30 seconds per plate. Option B. Hold the plates 10 centimeters (4 inches) from the patient's eyes under bright fluorescent light and allow 5 seconds per plate. Option C. Hold the plates 75 centimeters (30 inches) from the patient's eyes in good lighting and allow 3 seconds per plate. Option D. Hold the plates 1 meter from the patient's eyes in dim lighting and allow 10 seconds per plate. The correct answer is C. The Ishihara color vision test must be administered under standardized conditions. Plates held approximately 75 centimeters (30 inches) from the patient's eyes in good natural daylight or equivalent artificial lighting, not dim or overly bright, with approximately 3 seconds allowed per plate. The patient identifies the number or traces the winding path visible in each plate. This distance and timing prevent the patient from using pattern cues rather than color discrimination. Question 50. A medical assistant is reviewing the EHR audit trail report for a patient whose family member has expressed concerns about potential unauthorized access to the patient's health information. Which information does the EHR audit trail provide about record access? Option A. The identity of each user who accessed the record, the date and time of access, and what actions were performed, viewed, edited, printed. Option B. Only the dates when the patient's chart was opened, without identifying who accessed it. Option C. The complete content of every note documented in the patient's chart. Option D. Only access by providers, excluding administrative staff access records. The correct answer is A. EHR audit trails track all access to patient records, documenting who accessed the record, user identity, when access occurred, date and time, and what actions were taken: viewing, editing, printing, transmitting. This comprehensive tracking supports HIPAA compliance, security monitoring, and investigation of potential unauthorized access or breaches. Question 51. The clinic receives a patient satisfaction survey with a low rating and a comment stating, "The staff didn't explain what was happening during my visit and I felt rushed." Which analysis and response approach best addresses this feedback? Option A. Add the patient to a list of difficult patients for future staff awareness. Option B. Dismiss the survey as an isolated complaint since most patients rate the clinic highly. Option C. Contact the patient directly to argue that the medical assistant did explain the procedure properly. Option D. Review communication protocols, identify workflow factors causing rushed interactions, and implement staff training on patient communication. The correct answer is D. Patient satisfaction surveys provide valuable feedback for quality improvement. The complaint indicates communication gaps, lack of explanation, and rushed feeling. Professional response involves analyzing root causes, workflow pressure, protocol gaps, implementing targeted improvements, communication training, workflow adjustments, and viewing feedback as an improvement opportunity rather than a defensive challenge. Question 52. When assessing the integumentary system, which characteristic of a mole should prompt immediate provider notification according to the ABCD rule? Option A. Elevation that is slightly raised from skin surface. Option B. Diameter greater than 6 mm. Option C. Color that is uniform brown throughout. Option D. Border that is smooth and well-defined. The correct answer is B. The ABCD rule for melanoma detection includes asymmetry, irregular shape, border, irregular or poorly defined, color, varied or uneven, diameter, greater than 6 mm, and evolving, changing over time. A diameter exceeding 6 mm is a warning sign that distinguishes potentially malignant lesions from benign ones. Question 53. Which type of insulin has the fastest onset of action, typically beginning to lower blood glucose within 15 minutes after administration? Option A. Insulin glargine, long-acting. Option B. NPH insulin, intermediate-acting. Option C. Insulin lispro, rapid-acting. Option D. Regular insulin, short-acting. The correct answer is C. Rapid-acting insulins such as insulin lispro, Humalog, insulin aspart, Novolog, and insulin glulicine, Apidra, have the fastest onset of action, beginning to work within 10 to 15 minutes. These are administered right before or immediately after meals to control postprandial blood glucose spikes. Question 54. A medical assistant is assisting with a sterile procedure. The assistant accidentally touches the sterile field with an ungloved hand. Which action should the assistant take? Option A. Apply sterile gloves and continue working. Option B. Notify the provider immediately so the sterile field can be reestablished. Option C. Spray the contaminated area with antiseptic solution and continue. Option D. Continue with the procedure as only a small area was contaminated. The correct answer is B. Surgical asepsis requires that any break in sterility be immediately addressed. When an ungloved hand touches a sterile field, the entire field is considered contaminated. The assistant must notify the provider immediately so appropriate action can be taken, which may include replacing contaminated items and reestablishing a sterile field before continuing. Question 55. A black box warning on a medication label indicates which of the following? Option A. The medication is a controlled substance with abuse potential. Option B. The medication is only available through special pharmacy programs. Option C. The medication has the strongest FDA-required warning for serious or life-threatening risks. Option D. The medication is no longer approved for use in the United States. The correct answer is C. A black box warning, also called a boxed warning, is the most serious type of warning required by the FDA on prescription drug labeling. It appears in a black bordered box and highlights significant safety concerns such as life-threatening risks, serious adverse reactions, or restricted use populations. Examples include suicidality warnings on antidepressants and cardiovascular risks on certain NSAIDs. Question 56. A 58-year-old patient with type 2 diabetes is being seen for a routine follow-up visit. The provider orders diabetic foot care education. Which instruction should the medical assistant include when teaching this patient? Option A. Soak your feet in warm water daily to keep them soft and clean. Option B. Use a pumice stone aggressively to remove calluses and keep feet smooth. Option C. Apply moisturizing lotion between your toes to prevent dryness and cracking. Option D. Inspect your feet daily for cuts, blisters, red spots, and swelling, especially between toes where you may not feel injuries. The correct answer is D. Diabetic patients have reduced sensation due to peripheral neuropathy and may not feel foot injuries. Daily foot inspection is critical to detect wounds, blisters, or signs of infection before they become serious complications. Patients should check all surfaces, including between toes, use a mirror if needed, and report any abnormalities promptly. Early detection prevents diabetic foot ulcers and amputation. Question 57. A medical assistant is preparing to administer a subcutaneous injection of insulin to a patient who is thin with minimal subcutaneous tissue. Which technique adjustment should the medical assistant make? Option A. Use a 15-degree angle to ensure intradermal placement. Option B. Use a 90-degree angle with a longer needle. Option C. Inject at 90 degrees and aspirate before injecting. Option D. Use a 45-degree angle with a shorter needle. The correct answer is D. For subcutaneous injections in patients with minimal subcutaneous tissue, thin patients, a 45-degree angle with a shorter needle, 5/8 inch or 6 to 8 millimeters, allows proper placement into the subcutaneous layer without penetrating muscle. A 90-degree angle in a thin patient risks intramuscular injection. Question 58. A patient scheduled for an MRI scan mentions she has a pacemaker implanted 5 years ago for cardiac arrhythmia management. Which action should the medical assistant take regarding this patient's MRI appointment? Option A. Cancel the MRI and coordinate an alternative imaging study with the provider. Option B. Remove the pacemaker temporarily so the MRI can be performed safely. Option C. Proceed with the MRI scan at a lower magnetic field strength to minimize risk. Option D. Have the patient sign a waiver acknowledging the risks and proceed with the scan. The correct answer is A. Traditional pacemakers contain ferromagnetic components and electronic circuits that can be damaged, dislodged, or malfunction due to the powerful magnetic field of an MRI. This creates a life-threatening risk for the patient. The medical assistant must immediately notify the provider to cancel the MRI and arrange alternative imaging, such as CT scan or ultrasound. Some newer MRI-compatible devices exist, but verification with the cardiologist is required before any MRI exposure. Question 59. Which organ is located in the right lower quadrant, RLQ, of the abdominopelvic cavity? Option A, left kidney. Option B, stomach. Option C, appendix. Option D, spleen. The correct answer is C. The right lower quadrant, RLQ, contains the appendix, portions of the small intestine, cecum, and ascending colon, right ovary, in females, and right fallopian tube. The appendix is clinically significant because appendicitis typically presents with pain in the RLQ at McBurney's point, requiring prompt provider notification. Question 60. A medical assistant is positioning a patient for a sigmoidoscopy. Which position should the assistant help the patient assume? Option A, Sims position. Option B, dorsal recumbent position. Option C, Fowler's position. Option D, Trendelenburg position. The correct answer is A. Sims position, left lateral recumbent, is the standard position for sigmoidoscopy, rectal examinations, and enema administration. The patient lies on their left side with the left leg slightly bent and the right leg flexed sharply toward the chest. This position provides optimal access to the rectal area and uses gravity to facilitate the procedure. Question 61. A medical assistant is preparing discharge instructions for a 72-year-old patient with congestive heart failure, CHF. Which instruction is most critical to include for preventing readmission? Option A, weigh yourself daily at the same time, report weight gain of 2 to 3 pounds in 1 day or 5 pounds in 1 week. Option B, take extra diuretic doses whenever swelling is noticed in the legs. Option C, avoid all physical activity to prevent strain on the heart. Option D, increase fluid intake to at least 4 liters per day to stay hydrated. The correct answer is A. Daily weight monitoring is a cornerstone of CHF self-management. Rapid weight gain indicates fluid retention and worsening heart failure, often preceding visible edema or shortness of breath. The standard threshold is 2 to 3 pounds in 24 hours or 5 pounds in 1 week, which should trigger a call to the provider. Early detection allows medication adjustment before hospitalization becomes necessary. This is a key discharge teaching point within the CMA's patient education scope. Question 62. A medical assistant is conducting intake for 4 patients simultaneously in a busy family practice. Which task should the assistant prioritize first? Option A, reviewing the chief complaint of a 22-year-old with a sore throat. Option B, measuring the height and weight of a 30-year-old with a sprained ankle. Option C, completing medication reconciliation for a 65-year-old starting a new anticoagulant. Option D, taking vital signs on a 12-year-old presenting for a sports physical. The correct answer is C. Medication reconciliation for a patient starting anticoagulant therapy is the highest priority because anticoagulants have a narrow therapeutic index and significant drug-drug interactions. Incomplete reconciliation in this scenario poses the greatest risk for patient harm, bleeding events. The other tasks, while important, carry less immediate safety risk. Question 63. A medical assistant is creating a super bill for a patient who had an office visit, blood draw, and rapid strep test during today's appointment. Which information must be included on the super bill for accurate billing and claim submission? Option A, the patient's demographics, date of service, provider information, CPT procedure codes, ICD-10, CM diagnosis codes, and any applicable modifiers. Option B, the patient's insurance premium payment history and policy purchase date. Option C, the patient's complete medical history from previous visits over the past 5 years. Option D, Only the patient's name and date of service without any procedure or diagnosis information. The correct answer is A. A superbill is a document that captures all billable services provided during a patient encounter. Essential elements include patient demographics, name, date of birth, date of service, rendering provider information, CPT codes for procedures and services performed, such as office visit E/M code, venipuncture code, strep test code, ICD-10, CM diagnosis codes supporting medical necessity for each service, and any applicable modifiers, such as -25 for a separately identifiable E/M service. This information forms the basis for accurate claim submission. Question 64. A medical assistant works in a clinic that provides healthcare services to a local correctional facility. A detained patient requests confidential communication about a health concern that he does not want shared with correctional officers. Which patient right applies in this situation? Option A. All health information must be immediately reported to correctional officers. Option B. The medical assistant must obtain correctional officer approval before any patient interaction. Option C. Detained patients have no rights to healthcare confidentiality. Option D. The patient has the right to certain confidential communications that may not be shared with correctional authorities without consent. The correct answer is D. Individuals in correctional facilities retain certain healthcare rights, including the right to confidential communication with healthcare providers for certain health concerns. While some information may be required for safety or security purposes, detainees generally have rights to confidential discussions regarding sensitive health matters, including mental health, reproductive health, and communicable diseases, without automatic disclosure to correctional authorities. Question 65. A medical assistant is reviewing a claim for a patient who had 3 separate blood glucose tests performed on the same day at different times to monitor insulin dosing. Which modifier should be appended to the laboratory test codes to indicate these were repeat diagnostic tests performed for clinical reasons? Option A. Modifier -59. Option B. Modifier -76. Option C. Modifier -91. Option D. Modifier -25. The correct answer is C. Modifier -91 is specifically designated for repeat clinical diagnostic laboratory tests performed on the same patient on the same day. This modifier indicates that the repeat test was medically necessary and not a duplicate billing error. In this scenario, multiple blood glucose tests were performed at different times for insulin dosing monitoring, which is a valid clinical reason for repeat testing. Question 66. A medical assistant is taking vital signs on a patient who appears anxious about upcoming blood work. The patient's posture is tense, arms crossed, and facial expression shows worry. Which nonverbal cue indicates the strongest barrier to open communication? Option A. Fidgeting with hands. Option B. Facial expression showing worry. Option C. Avoiding eye contact. Option D. Tense posture with crossed arms. The correct answer is D. Crossed arms and tense posture create a defensive body position that signals emotional guardedness and potential resistance to open communication. This closed posture is a stronger barrier than facial expressions alone because it reflects a physical withdrawal that can impede rapport building. The medical assistant should work to reduce anxiety and encourage a more open posture through calming communication. Question 67. Which advance directive document specifically designates a trusted person to make healthcare decisions on the patient's behalf when the patient becomes unable to communicate or make decisions? Option A. Living will. Option B. Medical power of attorney, healthcare proxy. Option C, POST, physician orders for life-sustaining treatment. Option D, do not resuscitate, DNR order. The correct answer is B. A medical power of attorney, also called a healthcare proxy or durable power of attorney for healthcare, is a legal document that appoints a specific person to make healthcare decisions when the patient lacks decision-making capacity. The designated proxy can make ongoing medical decisions, unlike a living will which only addresses specific end-of-life treatments. Question 68. A medical assistance clinic receives notice that a patient's medical records are needed for an ongoing malpractice lawsuit. The clinic has been placed under a litigation hold. Which action is required? Option A, continue normal operations since litigation hold only applies to attorneys. Option B, release records immediately to the plaintiff's attorney without verification. Option C, preserve all relevant records and suspend normal destruction procedures until the litigation concludes. Option D, destroy records according to normal retention schedules since the lawsuit has not concluded. The correct answer is C. A litigation hold is a legal preservation notice that requires an organization to retain all documents and records relevant to pending or anticipated litigation. Normal destruction procedures must be suspended, and all relevant records must be preserved to prevent evidence destruction that could result in legal sanctions. Question 69. A medical assistant centrifuges a blood specimen and observes that the plasma appears milky and opaque rather than clear. Which pre-analytical error is most likely responsible for this appearance, and which laboratory test would be most affected? Option A, clotting in tube, hemoglobin levels will be falsely decreased. Option B, insufficient quantity, glucose levels will be falsely decreased. Option C, lipemia, triglyceride levels will be falsely elevated or interference in multiple tests. Option D, hemolysis, potassium levels will be falsely elevated. The correct answer is C. A milky, opaque plasma appearance indicates lipemia, which results from high levels of lipids, triglycerides, cholesterol, in the blood. Lipemia causes light scattering during spectrophotometric analysis, potentially interfering with multiple chemistry tests. While triglycerides themselves may be accurate, lipemia can interfere with other tests including sodium, chloride, and some enzyme assays due to the turbidity. Question 70. A medical assistant is verifying patient identity before administering an immunization in a busy clinic. The patient is wearing a hospital wristband from a recent stay, but the patient also verbally states their name and date of birth. Which approach to patient identification is most accurate according to safety protocols? Option A, skip identification verification because the patient is known to the clinic from previous visits. Option B, accept only the verbal confirmation because patients may not notice incorrect wristbands. Option C, rely solely on the wristband because visual identification is more reliable than verbal confirmation. Option D, verify both the wristband information and the patient's verbal statement of name and date of birth as two independent identifiers. The correct answer is D. The two-identifier rule requires verifying two unique patient identifiers before any intervention. A wristband provides one identifier source, and the patient's verbal confirmation of name and date of birth provides a second independent verification. Using both sources ensures the wristband belongs to the correct patient. Wristbands can be incorrect or from a different admission, and validates identity through patient participation. Question 71. A medical assistant is providing patient education on a newly prescribed bronchodilator, albuterol. Which common side effect should the medical assistant instruct the patient to expect and report if severe? Option A, excessive sleepiness. Option B, constipation. Option C, weight gain. Option D, tremors or shakiness. The correct answer is D. Albuterol and other bronchodilators, beta-2 agonists, commonly cause tremors, shakiness, or jitteriness due to stimulation of beta receptors in skeletal muscle. This is an expected side effect that patients should be informed about. Mild tremors are normal, but severe tremors should be reported to the provider as they may indicate dosing concerns or sensitivity. Question 72. During a minor surgical procedure, a medical assistant notices that a non-sterile instrument has touched the sterile surgical field. What is the correct response? Option A, cover the contaminated area with a sterile drape and continue. Option B, remove the contaminated instrument and establish a new sterile field. Option C, continue the procedure since only one item was contaminated. Option D, remove the contaminated instrument and replace it with a sterile one. The correct answer is B. When a non-sterile item contacts a sterile field, the entire field is considered contaminated. Surgical asepsis requires that any breach of sterility be addressed by removing contaminated items and establishing a completely new sterile field. Continuing with a partially contaminated field increases the risk of surgical site infection. Question 73. A medical assistant is preparing to apply an ACE bandage using a figure 8 technique to a patient's sprained ankle. Which statement accurately describes this wrapping method? Option A, the bandage spirals from the ankle upward without crossing. Option B, the bandage is applied only to the foot and does not cross the ankle. Option C, the bandage alternates crossing over the ankle joint in an X pattern. Option D, the bandage wraps in overlapping circles around the entire lower leg. The correct answer is C. The figure 8 technique is specifically used for joints such as the ankle. The bandage alternates crossing over the joint in an X pattern, with one turn around the foot below the ankle and one turn around the lower leg above the ankle, repeating this alternating pattern. This technique provides support to the joint while allowing some range of motion for functional recovery. Question 74. A patient who speaks only Mandarin arrives at the clinic for a follow-up visit. The patient's adult daughter offers to translate. What is the most appropriate action? Option A, accept the daughter's help to save time and resources. Option B, decline and rely on written instructions instead. Option C, arrange for a professional medical interpreter service. Option D, use a phone translation app on a tablet. The correct answer is C. Using professional interpreters ensures accuracy of medical information, maintains patient confidentiality, and avoids errors that family members may introduce through incomplete understanding or filtering of information. This is a best practice for culturally sensitive care. Question 75. A medical assistant receives laboratory results for a patient on warfarin therapy, 5.2 Indian rupees, hemoglobin 9.8 g/dl, and potassium 4.0 milliequivalent/L. The patient is scheduled for a routine follow-up visit in 2 days. Which finding requires immediate provider notification? Option A, hemoglobin 9.8 g/dl only. Option B, potassium 4.0 milliequivalent/L only. Option C, 5.2 Indian rupees only. Option D, both 5.2 Indian rupees and hemoglobin 9.8 g/dl. The correct answer is C. An INR of 5.2 is above the critical threshold, typically above 4.5 to 5.0 for patients on warfarin, and indicates a significantly increased risk of bleeding. This requires immediate provider notification for potential warfarin dose adjustment or reversal intervention. Hemoglobin of 9.8 g/dl is low anemia, but not a critical value requiring urgent notification. Potassium 4.0 milliequivalent/L is within normal range. Question 76. A medical assistant is removing an autoclave load of wrapped surgical instruments after a sterilization cycle. Which type of indicator provides the most reliable confirmation that sterilization conditions were met throughout the entire load? Option A, biological indicator, spore strip, placed in the center of the load. Option B, chemical indicator tape on the outside of each pack. Option C, mechanical indicator showing time and temperature on the autoclave display. Option D, color-changing indicator card placed inside each pack. The correct answer is A. Biological indicators using highly resistant bacterial spores, typically Geobacillus stearothermophilus, are the most definitive confirmation of sterilization because they directly test whether the process killed living organisms. Placing the BI in the most challenging location, center of the load, ensures the entire load achieved sterilization parameters. Question 77. A patient is scheduled for an MRI of the lumbar spine. During pre-procedure screening, the patient mentions they have a pacemaker implanted 3 years ago. Which action should the medical assistant take? Option A, notify the radiology team immediately because pacemakers are generally contraindicated for MRI. Option B, schedule the patient for a CT scan instead without consulting the provider. Option C, ask the patient to remove the pacemaker before the procedure. Option D, proceed with the MRI as scheduled since the pacemaker is old enough to be MRI safe. The correct answer is A. Pacemakers and other implanted cardiac devices are generally contraindicated for MRI because the strong magnetic field can interfere with device function, cause heating of leads, or reprogram the device, potentially causing serious harm or death to the patient. The medical assistant must immediately notify the radiology team and provider so alternative imaging can be arranged. Question 78. Which type of drug reaction involves the immune system producing an exaggerated response to a medication, potentially causing symptoms such as hives, swelling, or anaphylaxis? Option A, idiosyncratic reaction. Option B, side effect. Option C, adverse effect. Option D, allergic reaction. The correct answer is D. An allergic reaction is an immune-mediated hypersensitivity response to a medication. The body's immune system recognizes the drug or its metabolites as foreign and produces antibodies, leading to symptoms ranging from mild, hives, rash, itching, to severe, angioedema, anaphylaxis. Allergic reactions require prior exposure to sensitize the immune system and are not dose-dependent. Question 79. A patient arrives for a comprehensive annual wellness visit that includes vital signs, blood draw for lipid panel and CBC, urinalysis, vision screening, and immunization updates. The medical assistant has 20 minutes before the provider is ready to see the patient. Which sequence is most efficient and appropriate? Option A, blood draw, vital signs, urinalysis, vision screening, immunization review. Option B, vital signs, vision screening, blood draw, urinalysis, immunization review. Option C, immunization review, vital signs, vision screening, blood draw, urinalysis. Option D, vital signs, blood draw, urinalysis collection, vision screening, immunization review, while patient voids. The correct answer is D. This sequence optimizes workflow by completing vital signs first, baseline data, performing the blood draw while the patient is stationary, giving the patient the urine collection container to void independently while the CMA performs vision screening, and reviewing immunizations during the brief waiting period. This minimizes patient movement and uses time efficiently. Question 80. Which federal regulation specifically addresses the protection of electronic protected health information, EPCHI, through administrative, physical, and technical safeguards? Option A, HIPAA Privacy Rule. Option B, HIPAA Security Rule. Option C, Emergency Medical Treatment and Labor Act, EMTLA. Option D, Patient Safety Rule. The correct answer is B. The HIPAA Security Rule specifically establishes national standards to protect electronic protected health information, EPCHI, through required administrative, physical, and technical safeguards. The privacy rule covers all PHI regardless of format. Question 81. A medical assistant is providing discharge instructions to a patient with low health literacy. Which communication technique is specifically designed to verify patient understanding? Option A, providing written materials with large font and simple graphics. Option B, speaking slowly and pausing frequently to allow processing time. Option C, using simplified medical terminology to explain the diagnosis. Option D, asking the patient to repeat instructions in their own words, teach-back method. The correct answer is D. The teach-back method is an evidence-based technique for confirming patient understanding. It involves asking patients to explain or demonstrate what they learned in their own words, allowing the healthcare provider to identify misunderstandings and re-educate if needed. It is the gold standard for verifying comprehension. Question 82. Which of the following laboratory tests is not typically included in a comprehensive metabolic panel, CMP? Option A, albumin and total protein. Option B, alanine aminotransferase, ALT, and aspartate aminotransferase, AST. Option C, glucose and calcium. Option D, hemoglobin and hematocrit. The correct answer is D. A comprehensive metabolic panel, CMP, includes 14 tests: glucose, calcium, albumin, total protein, ALT, AST, alkaline phosphatase, bilirubin, BUN, creatinine, sodium, potassium, chloride, and CO2. Hemoglobin and hematocrit are part of a complete blood count, CBC, not a CMP. The CMP evaluates metabolism, kidney function, liver function, and electrolyte balance. Question 83. A medical assistant needs to collect a catheterized urine specimen from a female patient for culture and sensitivity testing. Which technique is correct? Option A, collect urine from the catheter drainage bag after clamping it for 30 minutes. Option B, disconnect the catheter from the drainage bag and collect urine directly from the tube. Option C, cleanse the catheter sampling port with antiseptic and aspirate urine using a sterile syringe. Option D, collect the first 10 milliliters of urine after inserting a new catheter. The correct answer is C. For a catheterized specimen, the sampling port is the designated access point. The port should be cleansed with antiseptic, and a sterile syringe is used to aspirate urine from the catheter. This maintains the sterile closed drainage system and prevents contamination. Urine from the drainage bag is not suitable for culture because it has been sitting and may be contaminated. Question 84. A medical assistant needs to communicate a patient's clinical status to the supervising physician before the provider enters the exam room. Which SBR format correctly structures this communication? Option A, situation. Mrs. Johnson is here for her appointment. Background, she has diabetes. Assessment, her blood sugar is high. Recommendation, you should see her now. Option B, situation. Mrs. Johnson, age 58, presents with fatigue and polyuria. Background, history of type 2 diabetes for 8 years, on metformin 1,000 milligrams twice daily. Assessment, blood glucose today is 285 milligrams per deciliter, BP 148/92. Recommendation, may need medication adjustment and lab work for A1C. Option C, situation. The patient is waiting. Background, she was here last month. Assessment, she looks tired. Recommendation, come see her. Option D, situation. Mrs. Johnson needs help. Background, she is diabetic. Assessment, I think something is wrong. Recommendation, fix her medications. The correct answer is B. SBR, situation, background, assessment, recommendation, is a standardized communication framework used in healthcare to ensure clear, complete information transfer. The situation identifies the patient and current concern. Background provides relevant history. Assessment includes objective clinical findings. Recommendation suggests appropriate next steps. The complete format includes specific details for each component. Question 85. A 6-year-old child presents with unexplained bruising on the back and upper arms. The parent states the child fell off the bed, but the bruising pattern does not match the explanation. What is the medical assistant's legal obligation? Option A, wait for the provider to make the determination about whether to report. Option B, respect the parent's explanation since there is no definitive proof of abuse. Option C, question the parent further to confirm whether abuse occurred before reporting. Option D, document the findings and report suspected child abuse to appropriate authorities. The correct answer is D. Medical assistants are mandatory reporters for suspected child abuse. Mandatory reporting requires reporting based on reasonable suspicion, not definitive proof. The inconsistency between the injury pattern and the explanation creates reasonable suspicion that warrants immediate reporting to Child Protective Services or law enforcement. Question 86. A medical assistant is preparing to store a newly received shipment of vaccines. Which storage requirement must be verified and documented? Option A, vaccines can be stored in a regular refrigerator alongside food items. Option B, vaccines should be stored at room temperature, 68 to 77 degrees Fahrenheit, in a locked cabinet. Option C, vaccines should be frozen at -20 degrees Celsius -4 degrees Fahrenheit for maximum stability. Option D, vaccines must be refrigerated at 2 to 8 degrees Celsius, 36 to 46 degrees Fahrenheit, with continuous temperature monitoring. The correct answer is D. Most vaccines require refrigeration at 2 to 8 degrees Celsius, 36 to 46 degrees Fahrenheit, with dedicated pharmaceutical-grade refrigerators and continuous temperature monitoring and documentation. Temperature excursions outside this range can compromise vaccine potency and require reporting and potential disposal. Question 87. What are the WHO-5 moments for hand hygiene that healthcare workers must follow? Option A, before administering medications, before taking vital signs, after each patient, before documentation, after phone calls. Option B, before touching a patient, before clean/aseptic procedures, after body fluid exposure risk, after touching a patient, after touching patient surroundings. Option C, after donning gloves, before doffing gloves, after each task, before patient discharge, after cleaning equipment. Option D, before entering the building, before eating lunch, after restroom use, before leaving the building, after clocking out. The correct answer is B. The WHO 5 moments for hand hygiene are internationally recognized evidence-based moments when hand hygiene is critical to prevent healthcare-associated infections. 1. Before touching a patient. 2. Before clean/aseptic procedures. 3. After body fluid exposure risk. 4. After touching a patient. And 5. After touching patient surroundings. These moments protect patients from colonization and infection and protect healthcare workers from acquiring pathogens. Question 88. A medical assistant is providing discharge instructions to a 72-year-old patient with low health literacy who is being sent home with new medications for hypertension. Which approach best demonstrates patient-centered care communication principles? Option A. Use the teach-back method with plain language, verify understanding, and involve the patient's caregiver. Option B. Provide written instructions only and tell the patient to call if they have questions. Option C. Assume the patient understands since they nodded during the explanation. Option D. Speak quickly to avoid keeping the patient waiting and provide medical terminology for accuracy. The correct answer is A. Patient-centered care communication adapts to the patient's needs, uses plain language, verifies understanding through teach-back, and involves caregivers when appropriate. This approach ensures comprehension, respects the patient's limitations, and promotes safe medication management at home. Question 89. A Medicare patient requests a screening colonoscopy, but the physician determines a diagnostic colonoscopy is medically necessary due to symptoms. The Advanced Beneficiary Notice, ABN, should be issued in which scenario? Option A. Before every procedure performed on a Medicare patient. Option B. When the physician expects Medicare will deny the service as not medically necessary. Option C. Only when the patient is enrolled in a Medicare Advantage plan. Option D. When the procedure costs exceed the patient's out-of-pocket maximum. The correct answer is B. An ABN Form CMS R-131 is given to Medicare beneficiaries before receiving items or services that Medicare is expected to deny as not medically necessary. It informs the patient of the potential financial liability and allows them to make an informed decision about proceeding. Question 90. A medical assistant is speaking with a patient about medication adherence. The assistant makes eye contact, nods, and says, but simultaneously reviews the computer screen and types notes. The patient pauses and then says, I guess it doesn't really matter what I think. What communication principle has been violated? Option A. Failure to maintain professional boundaries. Option B. Incongruence between verbal and nonverbal messages. Option C. Use of closed-ended questions. Option D. Inappropriate use of medical terminology. The correct answer is B. The assistant's verbal and minimal nonverbal cues, nodding, signal listening, but looking at the screen and typing communicates inattention. This incongruence sends a mixed message and the patient correctly perceives the lack of genuine engagement, as shown by the patient's withdrawn comment. Question 91. What is the primary purpose of Good Samaritan laws as they apply to healthcare professionals providing emergency care outside their workplace? Option A. To grant healthcare providers the authority to perform procedures beyond their normal scope of practice. Option B. To protect healthcare providers from civil liability when rendering voluntary emergency aid in good faith. Option C. to require healthcare workers to provide emergency assistance whenever possible. Option D, to establish a legal duty for medical assistants to respond to all medical emergencies. The correct answer is B. Good Samaritan laws are designed to encourage healthcare professionals and others to assist in emergency situations by providing legal protection from civil lawsuits when aid is given voluntarily, in good faith, and without expectation of compensation. These laws recognize that fear of liability might otherwise prevent people from helping in emergencies. The protection applies when the responder acts within reasonable standards and does not demonstrate gross negligence. Question 92. Which of the following correctly describes the limb lead electrode placement for a 12-lead EKG? Option A, right arm, white, left arm, black, right leg, green, left leg, red. Option B, right arm, white, left arm, black, right leg, black, left leg, red. Option C, right arm, black, left arm, white, right leg, green, left leg, red. Option D, right arm, white, left arm, black, right leg, green ground, left leg, red. The correct answer is D. The standard limb lead color coding is right arm equals white, left arm equals black, right leg equals green, ground, left leg equals red. The mnemonic snow over grass, white over green on the right, and smoke over fire, black over red on the left, helps remember this placement. The right leg electrode serves as the ground. Question 93. A patient calls the medical office and states, "I want a copy of my entire medical record from the past 5 years. I had multiple visits and lots of lab tests. What will this cost me?" Under HIPAA, the medical office may charge reasonable costs for copying records. Which fee structure represents the HIPAA-compliant approach to patient record copying fees? Option A, the office may charge any fee the patient agrees to pay, including markup for profit. Option B, the office may charge only the reasonable labor costs for copying, plus supply costs and postage if applicable. Option C, the office may charge a flat administrative fee per page that exceeds actual copying costs. Option D, the office must provide all records free of charge since patients have a right to access their health information. The correct answer is B. Under HIPAA, covered entities may charge patients a reasonable cost-based fee for copying medical records. This includes the labor costs for copying, time spent by staff to locate, copy, and prepare records, supply costs, paper, media, and postage if mailing the records. Facilities cannot charge for the time spent searching for records, and fees cannot include profit markup. Many states also have specific fee limits for medical record copying. Question 94. A medical assistant performs color vision testing using Ishihara plates. The patient cannot see the numbers embedded in several plates that have red and green dots. Which condition is the patient most likely demonstrating? Option A, macular degeneration. Option B, glaucoma. Option C, color blindness, color vision deficiency. Option D, cataracts. The correct answer is C. Ishihara plates are specifically designed to screen for color vision deficiencies, particularly red-green color blindness. The plates contain numbers or patterns formed by dots of specific colors that individuals with normal color vision can distinguish, while those with color deficiencies cannot. Inability to see numbers in red-green plates indicates probable red-green color blindness. Question 95. A medical assistant discovers that a patient's weight was incorrectly documented as 185 pounds instead of 158 pounds in the electronic health record. The record has already been signed by the provider. What is the correct procedure for correcting this error? Option A, delete the incorrect weight entry and enter the correct weight. Option B, use whiteout to cover the incorrect entry and write the correct weight. Option C, add a late entry, addendum, noting the error, the correct weight, the date, time, and the medical assistant's initials. Option D, ask the provider to delete the entire encounter and start a new documentation. The correct answer is C. Medical records are legal documents and cannot be deleted, altered, or erased. Corrections must be made by adding an addendum that identifies the error, provides the correct information, and includes the date, time, and signature/initials of the person making the correction. The original incorrect entry remains visible. Question 96. A medical assistant is preparing to test a patient's visual acuity using a Snellen chart. The patient wears bifocal glasses for distance and near vision. How should the assistant conduct the vision screening? Option A, test distance vision at 20 feet with and without correction, then test near vision at 14 inches with reading correction. Option B, test only without glasses to determine the patient's true vision without correction. Option C, test distance vision only with glasses on. Near vision is not part of standard screening. Option D, test distance vision at 10 feet and double the result. Near vision testing is optional. The correct answer is A. Comprehensive visual acuity screening includes both distance and near vision testing. Distance vision is tested at 20 feet using the Snellen chart, first with the patient's current correction, glasses/contacts, then without correction. Near vision is tested at 14 inches, 35 to 40 centimeters, using a Rosenbaum pocket screener or Jaeger card with the patient's reading correction. Documenting both corrected and uncorrected vision provides the provider with complete information about the patient's visual function and correction effectiveness. Question 97. A medical assistant witnesses a provider abruptly terminate care for a non-compliant diabetic patient without arranging follow-up or referral, stating, "I'm done with this patient." The patient has an active infection requiring ongoing treatment. Which legal concept applies to this situation? Option A, patient abandonment. Option B, informed consent violation. Option C, scope of practice violation. Option D, HIPAA violation. The correct answer is A. Patient abandonment occurs when a healthcare provider terminates the professional relationship without giving adequate notice or arranging for alternative care, particularly when the patient still needs ongoing treatment. Abandonment can result in negligence liability, especially when the patient has an acute condition requiring continued care. Question 98. A medical assistant is assisting with allergy scratch testing. After applying allergen extracts to the patient's forearm and lightly scratching the skin, how long should the assistant wait before reading and documenting the test results? Option A, 15 to 20 minutes. Option B, 60 to 90 minutes. Option C, 5 to 10 minutes. Option D, 30 to 45 minutes. The correct answer is A. Allergy scratch tests, also called prick tests or puncture tests, are read 15 to 20 minutes after application. This time allows the immediate hypersensitivity reaction, type 1, to develop if the patient is sensitized to the allergen. A positive reaction appears as a wheal, raised bump, with surrounding erythema, redness. Reading too early may miss developing reactions. Reading too late may result in fading reactions or false positive irritant responses. Question 99. Which abbreviation on a prescription label indicates that the medication should be taken immediately or as soon as possible? Option A, STAT. Option B, QID. Option C, AC. Option D, PRN. The correct answer is A. STAT is a Latin abbreviation derived from statim, meaning immediately or at once. Medications labeled with STAT should be administered without delay, typically for urgent or emergency situations. This differs from scheduled medications that are taken at specific times or PRN medications taken as needed. Question 100. A pathology laboratory sends a biopsy result report to the medical office showing a malignant finding. A radiology center sends an MRI report showing abnormal findings. Which approach should the medical assistant use for filing these diagnostic reports in the patient's medical record? Option A. File only the pathology report, since radiology reports are typically stored at the imaging center and not in the primary practice record. Option B. File both reports together in a general lab results section without distinguishing between pathology and radiology. Option C. File the pathology report in the pathology/laboratory results section and the radiology report in the radiology/imaging reports section, both with clear patient identifiers, dates, and provider notification flags for abnormal findings. Option D. Keep both reports in a temporary, pending review folder indefinitely without filing into the permanent record. The correct answer is C. Pathology and radiology report filing should organize reports by type in appropriate record sections. Pathology reports in laboratory/pathology sections and radiology reports in imaging/radiology sections. Both reports require proper patient identifiers, dates, and should be flagged for provider notification when they contain abnormal findings, malignant pathology, abnormal MRI. Organized filing supports efficient retrieval and appropriate clinical response to significant diagnostic findings.